Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, dear student. Wish you are all well and in a good health. Today's topic is brain death. I'm Dr. Amira Wahdan, Assistant Professor of Forensic Medicine and Clinical Toxicology. Before we start, we show you what are the learning objectives. What is brain death? Why we need to determine brain death? What are the types? What are the causes? What are the preconditions for the diagnosis of brain death? What are the precautions taken before certifying brain death? And finally, conflicts about brain death. Any catastrophic event, I mean with catastrophic event, any accident like falling from height, a car accident, someone was hit by wooden stick or by block of wood, any accident that hit the person or his head will lead to either heart stoppage, and this is known as pronounced death, or this is known as death, or sometimes the person can be resuscitated and return to life again, or sometime after resuscitation he need to be connected to ventilator. After connection to the ventilator for some time, some persons are weaned from the ventilator and return to life normally, or sometimes they are declared brain death. Our topic today is when to say that brain death is a pronounced death or an actual death. Okay, this video will show you what happened or what occurred when someone died. Let's see the video with each other.
Consciousness. Brainstem death, however, is substantially different from coma. Brainstem death is a term used to describe the whole brain dying, both the cortex and the brainstem. If the brainstem dies, respiration will stop. Once the heart stops receiving oxygen, it too will die and stop beating, and all other organs also die as a result of oxygen deprivation. The patient had been put on a ventilator to help him breathe, and afterwards his brainstem died. Even though the brainstem is dead and the lungs no longer function, the heart continues to beat because it is artificial.
So, in this video, we showed that the person can die by either stoppage of the heart and lung, and this is the known death, stoppage of the heart and lung, or sometimes the brain stop functioning. When the brain stop functioning, the problem is not that the brain affects the heart or control the heart, so the heart will die, but the problem is the brain containing the respiratory center. So when the brain stop functioning, the respiratory center included in the brain will stop functioning. This lead to hypoxia or oxygen deprivation. The oxygen deprivation which occur will lead to death of all organ of the body, including the heart. But if I connect this person to a ventilator, so oxygen will be conducted to the tissues, including the heart, so the heart can regain beating again with its autonomous rhythm, and it will continue to beat for hours, days, or even months on while the person is connected to the ventilator. So, what is brain death? The universal definition is irreversible loss of all function of the brain. At the end of this lecture, you will know that this definition can be modified to conclude or to include just small area of the brain, not all function of the brain. But this is the definition which is accepted by all the health guidelines. The definition of brain death is irreversible loss of all function of the brain. Possible situation for diagnosis of death. We have either to diagnose death in outside the intensive care unit or inside the intensive care unit. What is the difference between the inside or outside the intensive care unit? The difference is that in the intensive care unit, the person or the patient is connected to equipment that support his life, including the ventilator. While outside the intensive care unit, there is no equipment that support life. So if the heart or lung or brain stop to functioning, this person will lose his life a few minutes later. Outside the intensive care unit include any area outside the intensive care unit, including the home, hospital ward, the street, any area outside the intensive care unit. Why we need to determine brain death? As we said before, sometimes the person is connected to the mechanical ventilator, and the mechanical ventilation can keep his vital function acting for hours or even days, even in the presence of irreversible CNS insult. This is the what why we said in the previous video that sometimes the person has irreversible damage in his brain, and while connected to the ventilator, while connected to the ventilator, his heart and his lungs still acting and beating and pushing or giving blood to all organs of the body. The second cause, when the concept of brain death appeared to life or appeared in the society, it was accompanied by another concept, which is organ transplantation. Why? Because the person who has CNS insult, irreversible CNS insult, is considered dead or brain dead, and in spite he has viable organs because he is connected to the ventilator and his heart is still beating, so his organs are viable. So this person is a good source for organ transplantation, or viable organ for needed for organ transplantation. The third cause, there is a category of brain death, which is a cortical death or cerebral death. In this category, the person is unaware of himself and the surrounding and unresponsive to external stimuli, but instead he is very much alive. Why he is very much alive? Because he is not connected to ventilator. He can breathe spontaneously. So this category cannot consider if the insult is in the cerebral cortex only. This category is not considered included in the brain death diagnosis. Before we proceed in our lecture, we will revise quickly the brain anatomy. The brain has two cerebral hemispheres, which are known as the cerebral cortex and brain stem. Also, there is cerebellum, which is not included in our lecture today because it has nothing to do with our lecture. What is the function of the cerebral cortex? The cerebral cortex is responsible for cognition, voluntary movement, and sensation. What is cognition? And what is the difference between cognition and consciousness? Consciousness is a broad concept. It is divided into two sub concepts, which are cognition and arousal. Cognition or awareness, and arousal or wakefulness. The cognition is done by the cerebral cortex, while the arousal or wakefulness is done by the reticular activating system, which we'll know about later on in this lecture, inshallah. So, the person to be fully conscious should have two concepts, should have cognition and arousal. Both should be present to say that this person is fully conscious. The cognition is the function of the cerebral cortex, while the arousal is the function of the reticular activating system. While the brainstem consists of midbrain, which contain the nucleus of the cranial nerve number 3, which is responsible for the pupillary function and eye movement. The next bones contain the nuclei of the cranial nerve 4, 5, 6. These cranial nerves are responsible for the conjugate eye movement and corneal reflex. The third part is the medulla. Medulla contain the nuclei of the cranial nerve 9 and 10, which are responsible for the pharyngeal reflex or the gag reflex and tracheal reflex or the cuff reflex. Also, the medulla has the respiratory center, which is the most important part in the brain, and this is the cause for which the person who has irreversible CNS insult will lose his life because of the stoppage of the action of the respiratory center. The reticular activating system, I just mentioned that before. The reticular activating system receives multiple sensory impulses or inputs from different areas of the body and is responsible for normal wakefulness or arousal of the person. The reticular activating system is present in the brain stem and it is responsible for the arousal part from consciousness. We said before that cognition is the function of the cerebral cortex and the arousal is the function of the reticular activating system. So, what's the types of brain death? First, there is cortical or cerebral death. Second, brainstem death. Third, whole brain death. Let's start with cortical or cerebral death. But the condition is the cortical death is with intact brainstem. The brainstem is intact, no problem in the brainstem, but the cortex only is affected. This is characterized by the person is unresponsive to stimuli, including visual, auditory, tactile stimuli. All sensation is lost except the pain sensation. Why the pain sensation is reserved? Because there is subcortical areas which contain some pain centers, so this person can feel pain, but the reaction or the reflex to pain is different from our reaction to pain, to normal person reflex or reaction to pain. Also, this person, because the brainstem is intact, so the respiratory center is intact, so he has spontaneous respiration and cardiac function. This person is said to be in a vegetative state. What is the vegetative state? Vegetative state means like the plant, حياة خضرية. Why? because the plants are living things. The plant can grow, can drink, can eat, but it is not responsive to the surrounding environment. You cannot speak to the plant, you cannot hear them. So the person in case of cortical death will be like plant. He is a living person. He can breathe, he can grow, he can drink, but he cannot respond to you. Such cases are not considered death, are not considered dead, and may live without resuscitation for years, but just they need good nursing care and nutritional support. They doesn't need they don't need to be connected to ventilator because they can breathe spontaneously. What are the causes of vegetative state or cortical death or cerebral death? The causes can be chronic, as in cases of Alzheimer's disease. You can see the no healthy brain on the left side, and the brain in case of severe Alzheimer's disease. You can see the atrophy of the cerebral cortex. Sometimes the cause is acute insult to the brain, as in cerebral hypoxia, toxicity, widespread brain injury, diffuse axonal. Video will show you a case of person who is in vegetative state. Let's see the video.
In this video, a patient in a persistent vegetative state is shown. This patient had a severe traumatic brain injury 5 years previously that led to this state. Some elements of the neurological examination are demonstrated here. Responses follow reflexive pathways in the brainstem and are not associated with sensations or other integral faculties. First, we see a lack of responsiveness and no awareness of surroundings by the patient. The eyes are closed. We see there is no response to a voice command and no eye opening. We see that after a pain stimulus is applied, the patient develops a spontaneous clonus and opens the eyes. We see that the patient is not responding to a salvo of loud hand claps. In addition, a nail bed compression stimulus produces a generalized clonus, but again there is no sense of awareness and no grimacing. In this close-up view of the eye, nystagmoid eye movements are seen. Note that the right eye is red due to a filamentary keratitis, which is a well-known complication with patients who are in a permanent vegetative state. We now demonstrate the abnormal phenomenon known as doll's eyes. With head turning, the eyes move back and forth. Furthermore, there is no blinking to threat in both eyes, and no tracking of the reflex hammer. The eyes move erratically, but never fixate. Tapping on the lips produces a positive snout reflex. Here we demonstrate marked spasticity and contractures in the lower extremities. A clonus is easily elicited with a reflex hammer. Reflexes are brisk in the lower limbs, but difficult to elicit in the ankles due to ankle contractures. However, a clonus can still be found. Absence of visual fixation defines the presence of a vegetative state. This can be tested in various ways, but a mirror test is most reliable. In a normal mirror test, as demonstrated here, a large mirror is moved in front of the eyes, causing the patient to move the eyes following every movement of the mirror. This eye fixation is caused by the reflection of the room in the large mirror and cannot be suppressed in a patient with normal responses. It should be pointed out that the use of a pocket mirror with much less reflection will not be sufficient to elicit the response. Then we demonstrate a patient in persistent vegetative state who shows no evidence of eye fixation when we move a large mirror in front of his eyes. The major neurologic findings are: the eyes are open, but there is no awareness with any provocative test. There is at no point any evidence of expression or comprehension. There is no eye fixation or reproducible tracking of objects. There is evidence of diffuse hemispheric injury, but brainstem reflexes are usually intact.